My name is Amal Nirgudkar. I'm the CEO of Patient Prism. I'm delighted to welcome Mitch Olan here. He's a dear friend of mine, and I've known him for a few years, but I've known of him for over 2 decades. He is the executive chairman of the board for Dental Care Alliance. He basically was one of the founders of Dental Care Alliance in 1994 when they started out with 4 offices, and now they're almost at 300. And he's been one of the leaders of the DSO movement, even before the word DSO started. And I have him here because I wanted to talk to him about, what it means to scale up into how do you grow from 4 to 300, right? And the journey has been arduous, and there's a lot of lessons that you've learned over the years, some good ones, some bad ones. But really, the topic for this segment I wanted to discuss was, as you grow practices, obviously you can start de novo ones, you can start brand new ones, but most of your acquisitions have been existing practices. What kind of due diligence did you do? Like, how did you, and did that process evolve as you went from 4 to 10 to 50 to 100? What kind of due diligence did you look at? What did you look at when you were looking at practices to acquire?
Mm-hmm. Mm-hmm. Good question. The due diligence process has evolved as the sophistication of the business has evolved.
Sure.
And also the due diligence process is a little bit different for a one-off or a small office or a small group of offices as opposed to a larger group. Sure. For a larger group, DCA has been effective at affiliating with some of the largest groups out there. That's one of the differentiators that we're proud of, is the ability to affiliate with larger groups. But you have to bring in some additional support and expertise when doing due diligence on those organizations, because they are more complex and large and multi-site or multi-state. In looking at affiliating with the one-off practice, it's important, obviously, the basics. You look at the financials, you get the audited financials, the tax returns for the last couple of years. You look at the facility, how dated it is. You get some sense of what's going on with the staff, okay. The benefits and what have you. And you try to dig as deep as you can into that. What we found is many times an individual seller, a doctor that's looking to affiliate and sell their practice or a part of the practice, they're not going to have the financial sophistication. They're leaning on their support, the guidance from their accountants, their attorneys. Sure. And so you're limited as to what they can provide. But digging into those aspects is very critical. Ideally, if allowed to, and if you have the time, going a little layer deeper. Okay. And finding out if when you're looking at the staff, for example. Are there interpersonal relationships there? Are there connections? Are they family? Are they friends outside Sure. the business? Those things can all come back in some way, shape, or form, positive or negative, Sure. and catch you off guard when after the deal is done. Looking at financial situations. For us, it's always important to look at the selling doc too, and to get some sense of where they're at in their personal life. Sure. And are they financially strained? And what are the reasons for them wanting to get involved in a business like this? So those aren't always easy answers to get to, and it's a little bit deeper. It's another layer of the onion that you want to peel. But for the most part, on the one-offs, it's the basic areas of the finances, the facility, and the human resources, and the larger groups. Like I said, we'll bring in an outside firm that specializes in M&A due diligence to help us because of all the tentacles that are involved in a deal that size.
How deeper do you guys get in terms of understanding, like active patients, or what are they actually doing? So these specialist firms can come in and actually look at mm-hmm. like how the hygienists are doing, what kind of case acceptance rates do you have, what's the culture of the firm?
Actually, it's a good question. That's the one area that I left out in my answer is the clinical due diligence, and that is just as important as the financial due diligence or the facility due diligence. Sure. We have a clinical leadership within the organization that goes in and does chart audits.
Oh, wow.
And so they will go in and we'll take a sampling of the charts. We'll take a look at them. We'll see where opportunities might be, but we'll also see if there was anything that was done that would raise red flag. Also, as you work with an outside agency, they will have people that do nothing but that, and they can come in and they can dig a lot deeper on the larger deals, because as you can tell, if you're affiliating with a group that's got 15, 20, 30, 50 offices, which we have, there's a lot more to look at. But we have clinical leadership. We have a clinical committee. We have clinical directors in every market, and that are affiliated with us, and they come in and work with those with the due diligence process to make sure that what we are supposed to be getting is actually there. And we've walked away from some deals, candidly, if they just they don't set up right.
Even if financially the deal made sense,
correct.
Did you because of the clinical stuff you've walked away from deals?
Correct.
And how do you really avoid? I mean, that's the way, right? I mean, if you look at all elements, and you want to avoid surprises when you acquire them. Like, oh my God, we didn't. Have you guys had many surprises like that over the years?
Yes, we've had surprises. Have we had many? No.
Okay.
And as we grow and we do this more and more, you add to the list of areas that you want to look into.
Sure.
But just when you think you know it all, you come across something that's a surprise. But looking at how they're processing new patients, diagnosing, treatment planning, what's coming through the hygiene chair, how hygiene interacts with the general dentistry side, and then looking at the billing, which is also another critical piece. So what's being done at the back is being properly billed at the front. We've run across situations where that hasn't been the case.
Right.
And these are all, each one of these raises a red flag that it provides an opportunity to sit down with the seller to go through the situation, and if there's an explanation, and if it's a logical explanation, if it's something that can be addressed and fixed, you move forward. If it's something that isn't as easy to address or fix, you might want to take a step back and say, address this, and we'll be back in 6 months if you want to continue talking.
So it's not like so you have some sort of almost a template that you've built over the years that looks at clinical, financial, other stuff, right? And then you kind of go through it, and if anything that's not fixable, you'll walk away from the deal.
Correct.
Okay.
Correct. Or even if it is fixable, but we feel that it's going to take too much time, or we don't have an aligned goal of getting it fixed with the prospective affiliation, and we're not comfortable about it, we'll walk away. There's so much opportunity out there that you don't need to be chasing it. One of the folks within our organization says, another bus will come along in 10 minutes.
Right.
And so that is something that we try to keep in mind, even though sometimes it seems exciting at the time. We want to get this deal done, and we want to add to the footprint in a certain market or whatever the case might be. You have to know when to walk away.
That's the great point to leave this segment on. Thank you so much for the discussion.
My pleasure.
Thank you. Mm-hmm.